A debilitating form of arthritis that masks itself as back pain is affecting more people in the prime of their lives. In fact, as many as 1.2 million Americans suffer from this serious form of arthritis. Joining me this morning to explain more about this disease that's not well known and often left untreated is rheumatologist Dr. David Borenstein and Gotham, an arthritis spine patient who actually lives right here in Columbus. Doctor, arthritis of the spine, what is the technical term? I know it's a little difficult to pronounce, so I'll let you handle that part and then explain a little bit about what we're talking about here, please.
Sure. The topic for discussion is ankylosing spondylitis. It's the inflammatory arthritis of the spine. The inflammation causes troubles in the joints, including the sacroiliac joint down at the base of the spine, the lumbar spine, which is the low back, the thoracic spine, the chest, and can go all the way up to the cervical spine. And when this inflammation affects the joints, they can actually melt together. In other words, they can fuse. So when that happens, someone with this illness can have a fusion which goes from their low back all the way up to their head.
Wow. Certainly, doctor, a lot of Americans live with back pain, but why is this form so serious, and what should people be aware of to identify it?
Well, the usual back pain, which is second to the cold, the most common affliction of mankind, is usually associated with a muscle strain or could possibly be a herniated disc with some sciatica. Usually those people feel better after a 2-week to 2-month period of time, but people with spondylitis have their problems for decades. The difference being people who have the low back pain, the usual kind, want to stay still. The people who have inflammatory back pain, ankylosing spondylitis, want to keep moving because movement makes them feel better. So they really have a diametrically opposite to what the usual back pain patient experiences, and their disease can last for an extended period of time.
Gotham, obviously you've experienced this firsthand. Now, this diagnosis of AS is often missed, a lot of times for many years. What was your experience with this, including the diagnosis?
Well, you know, I started developing the symptoms when I was around 20 years old. You know, it was about 10 years ago, and you know, it was horrible pain from my neck to my hips, and you know, I couldn't sleep at night. You know, I'd be waking up at night, taking my dogs out for walks at 2 in the morning. I couldn't do things with my kids. You know, my work life was just being affected very much. And, you know, I went through several doctors. I went through a lot of medication, a lot of physical therapy. But, you know, being my own advocate, I was able to find a rheumatologist. And, you know, he was able to find the treatment for me. And, you know, now it's like, you know, my life is, it's great now. It's like I never had this pain before. Like it's like I'm cured from the AS.
Interesting. So. Could you just tell us a little bit about how you manage your AS, if you will?
Well, you know, I'm very active. I work out every day. I take my dogs on walks, play a lot. But I think the big thing was that, you know, I was able to find a rheumatologist who was able to get me the treatment that I needed. And I think that was the key that helped me.
All right, very good. And doctor, very quickly, we only have a few seconds left, but the keys to recognizing this as opposed to other types of back pain?
Well, one thing to do is you can go to faceyourbackpain.com, the Spondylitis Association of America, or the website of the American College of Rheumatology. We'll be able to answer the question you asked, that is separating out the usual type of low back pain from spondylitis. The diagnosis of spondylitis can be made by a rheumatologist, looking at the history, physical, laboratory tests for the genetic predisposition, and potential x-rays that one may need to really make this diagnosis and get on the appropriate therapy.
Gentlemen, great information. Thank you very much for sharing it with us today.
Thanks for having us.